our front desk verifies insurance coverage for patients that come in. They're brand new into our system, but the Florida hospital systems, those inpatients, the admitting department already verifies their information. So when we get this, when I pull this off and get this, I don't have to waste my time to re-verify. Right. We let the hospital work for us. So they've already verified all the insurance and everything. So I know in good faith that this information on this billing sheet is correct, and I'm going to go ahead and put it in the system and get it.
But you don't have this. You're gonna have the situation that the insurance is gonna cover the hospital attention, but it's not gonna cover the medical appointment.
There are insurance plans out there that only allow hospital billing versus physician's billing, and the professional component is what we call it. Our physicians fly underneath the professional component, and some insurances, Medicare A is only for hospitals. Medicare B, Part B coverage, covers the facility or covers the physician and all ancillary charges. There are some commercial plans out there that only allow $100 per day. And if you don't get your billing in quickly, you're going to miss out on that $100 time frame. Some insurances don't allow certain diagnoses. They have pre-existings. We don't know that. So our claim will be denied for a pre-existing condition, and then we have to determine, well, you know, what diagnosis codes are you allowed, and then we pull the documentation, the medical records, and review it to make sure that we can recode it on a payable diagnosis that's covered under their plan.
It's interesting, but it's so specific. Sometimes the insurance will say, why I'm getting a bill from the insurance if I'm supposed to be paying for the insurance? Because you have to pay a deductible. Until you don't pay $2,000, you're not going to receive anything from us.
That's a
Okay,
very
so I have to be so sick to pay $2,000 for the insurance. For the medical services, you know, if I pay only $100, I have to pay for them.
There are co-pays, co-insurance, and deductibles that need to be met before the insurance starts paying. Now, I don't know what those are, you know.
It's so specific of the plan. There are so many different plans. Right?
And there's always that disclaimer that says something to the effect of, it's never a guarantee of coverage. You know, based on your claim and being reviewed as to how they're going to determine what they pay and don't pay. And they pay 80%, and the balance goes to the patient, the 20%. Or if they have a co-insurance, a secondary supplement plan, then our computer system flips it over to that supplement plan, and then they get the bill electronically along with the primary payment from the EOB from the primary payer, and then they pay on the secondary part of the
primary
plan.
and secondary insurance. Like if I cover with my husband's insurance, but I have my insurance with the company that I work with. So it's gonna
There
be,
are all kinds of rules and regulations regarding two spouses with equal coverages. Some of it's based on date of birth. Your insurance is primary because you're actively employed, and your husband's insurance will be your secondary. But if you have the same plans, if you both have a Blue Cross Blue Shield plan, sometimes based on date of birth, your plan might be a secondary if you've retired or whatever, and your husband's plan is the primary and stuff like that. So, and then there's COBRA issues where you've terminated your employment and you want to pick up their insurance coverage. It's called COBRA, and you pay the premium out of pocket for yourself,
Yes,
but you
you
still
continue
continue
with the
to
same
have your health insurance coverage for up to 18 months. I think you can continue a COBRA coverage.
have you had like international patients that they have insurance from other countries?
We do have international patients all the time. This is the melting pot of Florida. And we have, there's a couple of international claims out of Canada. We have a global worldwide coverage program that's out of Miami that covers our international patients. And they have specific benefit and plan eligibility on their stuff for emergency situations, basically. When they come to the, you know, if you get the flu and you know, you just walk into a primary care doctor, They may or may not cover that, but based on the emergency and medical necessity, they'll cover those type of emergency situations.
Yeah, because you can buy it. Remember when my parents come, I just get the insurance for them during the time that they are going to be here, just in case if they get sick or something. Or there was another situation with my sister. She came to the U.S. and she got pretty sick and she had a surgery here. And then she was paid by a Social Security payment in Spain. The government of Spain paid for the whole account and she just sent the money to the U.S.
And that's another issue. If the
covered by the
patient
government.
receives the payment from the insurance company in good faith, they should turn it right over to us.
Yeah.
A lot of times, you know, in past history, sometimes that happens and sometimes that doesn't happen.
They get the money and they don't pay.
Right, and our bill will go to patient responsibility, and they start to receive their patient statements showing that, you know, we have received information from your insurance company that you have received payment. Please forward that payment to our office. And in good faith, they do, and sometimes, you know, the real rats, they don't.
And what are you going to do if they are in another place?
Just collections and stuff like that, and it writes off to bad debt, non-collectible.
Yeah,
and
but this is increase the costs for you, just to recover the money. Okay, that was excellent.
Anything else?
No, many things, but we don't have a lot of
Okay,
time.
okay.
I don't want to take most of the time.
Thank you.
Thank you, Cindy.